One thing that you haven't mentioned is that, for a patient with a large hiatal hernia, there is an issue of foreshortened esophagus, which is not an uncommon event for these patients with very large hiatal hernia. So what are the strategy options, for a patient with shortened esophagus?
You're right. In patients with chronic GERD and Barrett's esophagus, so this patient had 1 centimeter of Barrett's esophagus, you can fairly well predict that they'll have a foreshortened esophagus, which then makes recurrence of a hiatal hernia risk higher. So in that situation, the TIF procedure may have an advantage. There are other emerging endoscopic approaches for patients who have failed prior nasal fundoplication because of a foreshortened esophagus. But what are your thoughts about the patient with the foreshortened esophagus?
Well, intraoperatively, we can only do so much with regarding to lengthening of the esophagus, certainly, and, significant mobilization, and we do that in all cases. So we go through the hiatus and essentially mobilize the esophagus for approximately 7 or 8 centimeters into the mediastinum. We retract all the mediastinum pleura. That is the best way to mobilize the esophagus. But despite significant mobilization, some of these patients with large hiatal hernia, they just have a very foreshortened esophagus, and we cannot get the required length we need. Normally, you need 3 centimeter intra-abdominal esophagus to create an adequate fundoplication, and some of these patients, you don't have that. So that's where the issue lies with regarding to an anti-reflux procedure and working with these patients with very large hiatal hernia. In those scenarios, the only other surgical option available is a collis, gastroplasty. The laparoscopic collis gastroplasty is being done at certain center, and it can be done relatively safe, but nevertheless, it increase the magnitude of the operation and also the risk of the procedure. And just remember that a lot of the patients, with these giant hiatal hernia are in the elderly. One of the risks is really leakage at the level of the staple line. So certainly, you have to take the risk and benefit of this procedure into account when you approach a repair like this.